Big news with regard to possibly your health care. Years of chastising Obamacare, but not coming together with a coherent alternative of their own. Republicans have now put forth the American Health Care Act. It is an absolute and completely atrocious proposal, and I'm going to tell you exactly why. Here is the big announcement from Paul Ryan.
Afternoon. This is the American Health Care Act. It's been a long time in coming.
Right.
This bill, the American Health Care Act, it keeps our promise to repeal and replace Obamacare. It delivers relief to Americans fed up with skyrocketing premiums and fewer choices. It moves us away from the broken status quo toward a better patient-centered system.
It actually does quite the opposite. Let's start with the list of what is in the American Health Care Act, the list of American Health Care Act provisions. That list, which I will put up on the screen for you, begins with states would retain the option of running Obamacare-like exchanges and Medicaid expansion, retain the option being the key word there. The uninsured are penalized under this system, but in a very different way than under the Affordable Care Act. Tax breaks for employer-sponsored coverage are capped. People can stay on their parents' plans until age 26. Discrimination based on pre-existing conditions is prohibited, and insurers are required to cover mental health and substance abuse. So, based only on what I've told you so far, if you hated Obamacare, you should sort of not like this either, because it's a lot of the same stuff. But of course, anything branded as Trump care or passed under Trump, Trumpists will go with it, even if it has many similarities to the Affordable Care Act. But here's the really disastrous part. This so-called American Health Care Act tries to keep many parts of Obamacare, which understandably, a lot of those provisions are really popular with Americans. I understand why Republicans would actually try to keep some of these provisions, but it removes the aspects of Obamacare that allow it to actually function, okay? Here's list number 2, which is Obamacare provisions that are gone from, let's just call it Trump care now, for lack of a better term. The mandates are gone. New taxes are gone. Higher taxes on the rich to cover the costs are gone. Premium subsidies, as outlined in Obamacare, are gone. Medicaid guarantees are gone, and reasonable caps on what companies can charge older people are gone. This is why this combination of provisions doesn't work. The new Republican plan gets rid of individual and employer mandates. This was sort of the central Republican critique of Obamacare, but it's actually the thing that keeps it functioning. If you want healthcare to be affordable for everyone and cover people with pre-existing conditions, you've got to spread out the risk among the largest pool of people possible. This is called economies of scale. The more people you have paying in, the cheaper it will be on average for each individual customer. And I hate that I'm even calling these people customers, but that's what they are in a for-profit health insurance system. The Republican plan would do away with the fine for not having insurance and replace it with a fee that you pay to the insurance companies, and you pay it. You don't pay it on an ongoing basis. Think about the absurdity of that. Instead of paying the penalty to the government, you're paying the penalty for not having insurance to the for-profit health insurance company, and you only have to pay that penalty for 1 year. So there is a penalty for being uninsured, but the Republicans backing the plan say it's okay because you're paying it to a private for-profit insurance company. What's this going to do? This will incentivize young people and healthier people not to buy insurance until they're sick, which makes insurance more expensive by reducing the sort of average health level of people who have insurance. Altogether, this is going to make it so that you have, number one, fewer people paying into the market, and of the people who are paying in, more of them will be sick or less healthy. That fundamentally makes premiums increase, and it could potentially make the healthcare market implode. This is why the Affordable Care Act has the mandate. It's not because of big bad government looking to nanny state people. It's math. The Affordable Care Act is also financed in large part by taxes on the wealthiest Americans. This bill would repeal those taxes. People making over $1 million a year would get an average of a $50,000 tax cut. The richer you are, the bigger your tax cut. People in the top 0.1% would get an average tax cut of about $200,000. Also, and this is extra dangerous, this new bill, the American Health Care Act, it would repeal the Medicaid taxes, which are individually, singularly responsible for keeping the Medicaid trust fund afloat. And this is dangerous, Pat, because Republicans could defund Medicaid intentionally so that then it doesn't work as well and then use it as a justification to get rid of it altogether. Hey, listen, we should get rid of Medicaid. It's not working well. Well, it's not working well because you defunded it.
And Republicans are trying to market this bill as so much better than Obamacare because this bill is only 66 pages long. And they point out that Obamacare was somewhere between 1,000 and 2,000 pages. You saw Sean Spicer at a recent press conference
with
compare
stacks
the
of paper,
stacks of paper. But of the 66 pages in this new American Health Care Act, 7 of them have to do with states being allowed to take away Medicare coverage from lottery winners. So
Medicare or Medicaid? Medicaid,
so how did that fluff piece get in there?
It's the number of pages in the bill tells us anything objectively about whether it's good or bad is so it's pandering. And it's pandering to people who want government doing nothing. And when you actually ask serious questions, like at yesterday's press conference, one of Paul Ryan's buddies, this guy right over here with the glasses, I actually forget his name, he was asked, what will this do to the number of people who actually have coverage? There's 2.5 years, presumably, during which this is all rolled in. So what would happen in 2020? And the guy with the glasses, whose name is escaping me because he's such a despicable guy, he said something like, hey, we have no way to predict what's going to happen in 2020. That's 2.5 years away. What kind of an answer is that? I mean, it's just not an answer to the question that was asked. And fundamentally, look at what the bill does. And the last thing I want to talk about is the subsidies. Income-based subsidies go away. With Obamacare, the less money you make, the bigger subsidy you get. Because thinking clearly here, when you have less money, it's harder to afford health insurance. The AHA, the American Health Care Act, would instead put in place an age-based tax credit, meaning, number one, the older you are, the more subsidy you get, which is kind of counterintuitive in a way, because on average, the older people are, the more money they have, the less need they have for money to pay for their health insurance. And the entire tax credit thing, Pat, is a shout out of sorts. It's pandering to the lower my taxes crowd, because by doing it as a tax credit instead of as a subsidy, you can tout we cut people's taxes. Of course, you're doing it in a way that's self-destructive and counterproductive.
I really wonder if this is even going to pass, though, because it seems to be dividing even Republicans. There seems to be a lot of infighting at this point. Because some are considering this to be another entitlement, kind of like Obamacare light, and others are going to be angry that their constituents are going to lose the Medicaid expansion. So there could be a lot of infighting here. I don't know if Donald Trump is going to continue to own this, if it gets more controversial, if it's debated just as the Affordable Care Act was. So we'll see what the future of this is like.
Last thing I want to talk about. The Republican plan would also prevent Planned Parenthood from getting Medicaid reimbursements for a year. This has nothing to do with making healthcare more affordable. In fact, it would do quite the opposite. It's pandering to religious conservatives and social conservatives. It is absolutely and utterly insane. And what's going on is, now that the Republicans actually can repeal Obamacare, before they could try to repeal it in the House, didn't matter, Obama was going to veto it. Now that they actually can repeal it, many of them are saying, wait a second, millions of people will lose coverage. How is that going to impact my re-election chances? We will see what ultimately happens here. I predict that some Trumpists, anything that Trump signs his name to, no matter what it is, they will consider a major accomplishment. Send me your thoughts about this. I'm on Twitter at @Pakman.